Hello, I'm Dr. Amy Schreibman. I'm a nurse practitioner and a doctor of nursing practice. Welcome to Medical Minutes. Today we're going to talk about MRSA or MRSA. We often hear the acronym MRSA or MRSA, but do we really know what that means? MRSA is an infection caused by a staphylococcus or staph bacteria that's resistant to many different antibiotics, hence the name methicillin-resistant Staph aureus. These bacteria naturally live in the nose and on the skin and generally don't cause any harm. However, when they begin to multiply uncontrollably, a MRSA infection can occur. These infections typically occur when there's a cut or break in your skin. MRSA is very contagious and can be spread through direct contact with an infected person. It can also be contacted by coming into contact with an object or a surface that an infected person has touched. Though MRSA infection can be serious, it can be treated effectively with antibiotics. MRSA infections are classified as either hospital-acquired or community-acquired. The hospital-acquired type occurs when there's direct contact with an infected wound or contaminated hands. You can also become infected through contact by contaminated linens or poorly sanitized surgical instruments. The community type occurs by infections that are transmitted through close personal contact with an infected person or through direct contact with an infected wound. This type of infection may also develop as a result of poor hygiene, such as infrequent or improper hand washing. Hospital-acquired MRSA can cause serious complications, such as pneumonia, urinary tract infections, and blood infections known as sepsis. It is important to see your doctor right away if you notice any of the following symptoms: rash, headaches, muscle aches, chills, fever, fatigue, cough, shortness of breath, and/or chest pain. It is important when you visit a loved one in the hospital or nursing home, you wash your hands thoroughly and avoid sitting on the patient's bed. Community-acquired MRSA usually causes skin infections in areas with increased body hair, such as the armpits or the back of the neck. Skin that has been cut, scratched, or rubbed are also vulnerable to infection because skin is your first line of defense to germs. This type usually causes a swollen, painful bump to form on the skin, and that may resemble a spider bite or a pimple. It often has a yellow or white center and a central head. This may be often surrounded by redness and warmth. Some people also experience a fever. Risk factors include hospitalization within 3 months, regular hemodialysis, a weakened immune system due to another medical condition, living in a nursing home, sharing exercise equipment, towels, or razors with other people, participating in contact sports, working at a daycare facility, or living in a crowded or unsanitary condition. To verify, a physical exam will be performed by your healthcare provider along with blood, urine, sputum, and/or wound cultures. Treatment for each is differentiated. Hospital-acquired MRSA could cause severe and life-threatening infections which require IV antibiotics. Patients are placed in isolation temporarily until their infection improves. Community-acquired MRSA usually improves with oral antibiotics alone. To prevent MRSA infections, you must wash your hands on a regular basis for at least 15 seconds before drying them with a clean towel. Use another towel to turn off the faucet. Carry hand sanitizer that contains 60% alcohol and use it to keep your hands clean when you don't have access to soap and water. Keep your wounds covered at all times. Covering wounds can prevent pus or other fluids containing staph bacteria from contaminating surfaces that other people may touch. Do not share items like towels, sheets, razors, or athletic equipment. Sanitize your linens. If you have cuts or broken skin, wash bed linens and towels in hot water with extra bleach. You should also wash your gym equipment and athletic clothes after each use. Dry everything in the dryer at high heat. If you have any questions or comments on what we discussed today, please leave them in the comments section below and we will get back to you. Remember to follow us on Facebook or on our website, The Vocal Voice. I'm Dr. Amy Schreibman. See you next time on Medical Minutes.